Dr. Kieran Moore is joining me now. He is, of course, Ontario's Chief Medical Officer of Health. Dr. Moore, good to see you.
Good morning, Marcia.
All right, so lots to discuss, and we're going to get to RSV and the flu and the new variant in just a minute. I do want to start, though, by asking you about this new study that shows the effects of COVID misinformation contributing to deaths and hospital expenses over the course of 9 months. How much does it concern you that there is a segment of the population who clearly lack trust in public institutions?
Well, it's very troubling, Marcia, and I haven't had a chance to review that report in its entirety. But misinformation has been a constant issue across the globe to try to deal with increasing vaccination. Luckily, in Ontario, 91% of those over 18 have come forward and gotten 2 doses of vaccine. But I do think it's contributed in the long term a further protection of our communities. We have had the fall booster dose available to Ontarians. 3 million, I'm thanking every single one of them, have come forward for this fall booster dose, but we still are only at 55% of those over 70 and between 60 and 69 years of age, we're only at 40%. So we still have gaps in providing reliable information to Ontarians to make sure that they make informed decisions. And I'm not happy at present with our current coverage rates and our level of protection for those that are most vulnerable to the severe outcomes of this virus.
Well, yeah, we're hearing a lot about vaccine fatigue, that people didn't get their booster shots. And I'm wondering how that changes your job. How do you build back that trust? How do you get the word out to people?
It makes it much more difficult. So what we try to do is have multi-level communication to our citizens within Ontario. We trust our local public health physicians to communicate at a local level to build that trusting relationship. So we have 34 health units in Ontario. We trust our health system partners, the Ontario Health Association, our physicians through the Ontario Medical Association, and other organizations, nurses associations, to try to get the message out on a one-on-one basis to ensure that we answer any questions parents may have for their children or adults may have. So it is a tremendous amount of effort to try to counter misinformation and to build that trust. But we have had success in Ontario, as I've said, with that 91% of Ontarians 18 and over coming forward to get their second dose. But it's a never-ending attempt to try to continue to communicate effectively with our citizens.
So tomorrow, the World Health Organization will decide whether COVID-19 is still considered a global emergency. Just a couple of days ago, we were reporting on the fact that it's been 3 years, if you can believe it, since the first case was reported in Toronto. How will the WHO's decision impact the way we move forward in Ontario and in Canada?
Well, I want to assure Ontarians, Canadians that our efforts to combat COVID will not stop, even though the WHO may declare it technically no longer an emergency. Our efforts to continue to provide testing, immunization, therapeutics through oral outpatient treatments like Paxlovid absolutely will continue. We're facing a new strain variant of XBB, which may cause a rise in admissions to hospital. And so I don't want anyone in Canada or Ontario to think that we're going to stop our efforts to try to limit the spread of this virus.
Has a decision been made on the guidance of the vaccine moving forward in the United States this week? They were talking about having it be an annual shot, particularly recommended for those who are most vulnerable. What's your position on that?
So we're still waiting to hear from the National Advisory Committee on Immunization. I know they're looking at this issue of when to have the next dose available to Ontarians and Canadians. So is the Ontario Immunization Advisory Committee. We hope to have information to Canadians soon on that discussion. They want to evaluate all the best practices, the levels of evidence to support a decision like that. And certainly they're looking at the United States, the United Kingdom, and in Europe on their practices that they're going to adopt. I would think will be consistent with many international approaches to vaccination, given the level of immunity that we're building in Canada.
Dr. Moore, your office sent out some what you could call good news earlier today, saying that cases of flu and RSV have peaked. Of course, that's having an impact on our communities and on our hospitals. Is the season over? What's the outlook for the rest of winter?
Well, there is some good news. So across Canada, we experienced a very early, 2-month early influenza A wave, and it lasted its normal traditional 12 weeks. But it's because it started so early, it's ended early. And in Ontario now, less than 1% of our tests are positive. The burden of illness we had at the peak in late November, December, over 570 patients in the hospital with influenza alone. We're now down to 80 in Ontario, and the burden of them in the intensive care unit is less as well. So happy to see influenza behind us. We're certainly monitoring for any other strains of influenza that could come forward, but the worst of influenza appears to be way past us over 6 weeks ago. And so we're still having a burden of RSV, but that's trending in the right direction across Canada. And the burden of that illness on our hospital sector is decreasing. And COVID in Ontario is remaining relatively stable and not accelerating. We'll certainly watch that as XBB potentially becomes our next variant of concern, and keep Ontarians informed of that risk. But you're
Kieran.
right, Marcia, good news in general.
Yeah, especially for children
Yes.
who are hit so hard with RSV. Dr. Kieran Moore, always glad to have you with us. Dr. Moore is Ontario's Chief Medical Officer of Health.